a word that sends shivers down the spine of anyone who's ever experienced it. It's estimated that 1 in 7 people worldwide will experience a migraine at some point in their lives, highlighting just how pervasive this condition is. Migraines affecting 10% of the world's population are not just mere headaches. They are moderate to intense, throbbing, one-sided pains that can last from 4 to 72 hours, sometimes even longer. Accompanied by nausea, vomiting and sensitivity to light, these episodes can strike sporadically or several times a month. The most common type hits without any warning signs or aura. Ranking as the third most common disease worldwide, migraines disproportionately affect women who are 3 times more likely to suffer than men. In numbers, that's 1 in 5 women, 1 in 16 men and 1 in 11 children. Migraines mainly affect those between the age of 18 and 44, with the peak occurring in the 30s. In India, an estimated 15% of the population battles migraines, mirroring global trends. 17% of Indian women and 6% of Indian men experience migraines, most commonly between the age of 20 and 50. Each migraine has a unique set of triggers. Common culprits include stress, bright lights, loud sounds, strong smells, physical exertion, hormonal changes, and the infamous 5 C's: cheese, chocolate, coffee, cola, and citrus fruits. In India, majority of migraines are triggered by emotional stress, fasting, physical exhaustion, travel, and sleep deprivation, with 35% of sufferers encountering multiple triggers simultaneously. Though not typically life-threatening, migraines wreak havoc on daily life. They're the 6th highest cause of disability worldwide. The statistics are stark. 1 in 4 sufferers miss work or school, half struggle with housework, 1 in 3 miss out on family or social activities, and a staggering 80% with chronic migraines report reduced participation in family activities. So how can we reclaim our lives from migraines? What are the best strategies for management and treatment? To guide us, we have Dr. Ravishankar, an esteemed expert in this field. Welcome to the show.
It affects people across different age groups, and it can start even in children around the age of 8 to 10 and go on to affect people till the age of 50. The commonest trigger that we see in our part of the world is related to the weather conditions, the type of temperatures we have, the heat, humidity. I always tell my patients, do not treat just migraine the attack, treat migraine the disorder, so that in the long run, long term, your frequency, your severity, and your quality of life should improve.
What is a migraine? If you could just start by defining that for us.
Migraine is one of the commonest reasons why recurrent headaches happen, and it affects people across different age groups, and it can start even in children around the age of 8 to 10 and go on to affect people till the age of 50. Migraine is also known to occur beyond 50, but much less than in the younger age group. So whenever you find somebody coming with a history of recurrent headaches, which could be on one side or both sides or all around the head, and you find that there are trigger links, and you find when you ask the question that there is somebody else in the family also who gets recurrent headaches, then the penny should drop that what you're dealing with is probably migraine.
Okay. So how can a patient distinguish between a migraine or any other type of headache? And there are many types of headaches, such as tension headaches or cluster headaches, or brought on by other conditions as well.
Yes, the common headaches with which migraine can get confused are what is known as tension headaches, the sinusitis-related headaches, and much rarer are what you mentioned, cluster headache and new daily persistent headaches. Now, migraine is easy to recognize if you know the features, because as you have already mentioned, these are recurrent headaches which are associated with sometimes nausea, vomiting, inability to tolerate light, sound, sometimes smells, and they are highly disabling. The patient may not be able to function for almost 24 hours or even more. And there is a positive family history of not the same severity, but some recurrent headaches. Now, as against this, when you look at the other headaches, tension headache, they are more or less what we talk about them as featureless headaches. They are not associated with nausea, vomiting, disability, and they don't have trigger links so clear-cut as in migraine.
Okay.
And then when you come to cluster headaches, they are more always on the same side, accompanied by watering of the eyes, running nose, and they don't have trigger links too. So it is not difficult. And the commonest mistake which patients make on their own is to think that all recurrent headaches are due to a refractive error in the eye, and they go for an eye check to the ophthalmologist. They may have a small number, but they have to remember that if there are trigger-linked headaches, that eye problem is not the cause of their headache, and they have to seek correct medical opinion.
Okay. Well, you've mentioned trigger links, and that's quite an important part of migraines, a trigger which results in a migraine. Can you just tell us what is the most common trigger that one comes across when it is when one gets a probable migraine?
The triggers are generally divided across three different groups. One is the physiological within the body triggers. Two is from the environment and lifestyle. And there are some triggers which are beyond control. The commonest trigger that we see in our part of the world is related to the weather conditions, the type of temperatures we have, the heat, humidity in most of the cities for almost 6 to 8 months of the year. And then again, you have lifestyle related triggers, which are the habit of not having breakfast on a regular basis amongst most Indians, and school children having to leave so early for school, they really rush with just a glass of milk. They don't have a proper breakfast. Skipping meals, the fasting habits across different religions in the Indian subcontinent is responsible for throwing up a lot more migraines. And stress, where stress leads to lack of sleep, poor quality of sleep, and now in modern day times, you find increased screen exposure. Computers have become an essential part of education, laptops, and the mobile phone. Mobiles are small screens, they induce a lot of stress and strain, which can be a trigger for migraine. And apart from this, certain changes in the body, for example, the fluctuating levels of estrogen, which happen during the menstrual cycle of a woman, leads to, is a trigger for more migraines in women that we encounter. So these are some of the triggers. And then you have foods which are different from the rest of the world. It is well publicized, well published all over that chocolates, cheese, and red wine are the commonest cause of trigger. But when you come to see it in practice, these are not the common items which are consumed by most Indians. Yes, of course, they are correct triggers: aging cheese, chocolates, and red wine. But we have different food items which have the fermented food items like idli, dosa, dhokla. These are items which can also give rise to migraine attacks. And then rarely you come across different triggers. Triggers are different across individuals who suffer from migraine. So they are not the same for everyone, and one has to be alert that triggers are not seen always and not easy to identify. In about 70 to 80% of patients with migraine, you can identify the triggers, but you have to remember that there are 15 to 20% of patients in whom triggers may not be easy to identify.
So it's important to eat breakfast, but to probably prevent yourself from eating fermented foods if those are triggers.
If that is a trigger,
Okay.
you will have to observe across different attacks as to what might have induced. When you keep a big list in front of you and try to match any of those items on the list to the attacks and you find there is a commonality, then you'll have to identify that as a trigger for you. So eating breakfast correctly, a wholesome breakfast that provides good levels of glucose to the brain in the morning, and also trying to avoid those substances which you have noticed could induce a migraine attack in you is a very important point. And more important is to avoid fasting. Fasting for religious reasons can take a heavy toll because there are people who are fasting 2 to 3 times a week.
Correct.
So that many more migraines you will have to treat.
So why, when there is an onset of a migraine or you know that you've been exposed to a particular trigger, what can one do at that moment?
It stands to common sense that as far as possible, you try and avoid that trigger. You can't, of course, avoid certain triggers like the heat, humidity, the weather conditions, but there are some things which are doable. For example, breakfast. You plan for the 10-minute breakfast. You plan for it the previous night and make sure the child gets up early or the breakfast is ready for the child before going to school. That's one thing. Selecting your breakfast. There are many breakfasts which don't need a long time for preparation. So that is important to plan for. And what triggers you can avoid, like skipping meals, delaying your meals when you're going to work. Now there are a lot of corporate people who continue to work and delay and postpone and have their meals at their lunch at 3 p.m. and so all that should be compulsorily avoided with the conscious awareness that you are a migraine sufferer whose body will not tolerate, because the human brain is highly sensitive. So scrupulously taking care of all the things like going to sleep at the same time, getting up at the same time, maintaining the chronobiology and doing the same things every day. You cannot party one night and then sleep at 9 p.m. the other night. And then, so you have to enjoy life too. But at the same time, you should be conscious of the fact that too much of variation in your routine daily lifestyle can trigger off more migraine headaches.
Okay. So what if you're exposed to a trigger? What if you had dosa for breakfast and it is hot outside as well, and both of them are triggers? What would you do at that moment in the light of the fact that you're probably going to get a migraine?
Yes, we instruct all our patients to be ready for a migraine headache at any point of time unannounced. So they should always be having their emergency medicine kept in their bag so that in case they get an attack, in fact, sometimes we tell youngsters also that there is no need to announce that you have migraine when you attend a party and stay away from pizza and pasta and other things. Keep the emergency medicines ready with you, and in case the headache starts, if you take the emergency medicine at the earliest onset, then you can abort the attack and you need not go through the usual suffering for 2 to 3 hours, and within an hour you can come back to normal functioning.
What is the medicine that one needs to probably look at?
One has to remember that migraine attacks are not all the same across different individuals. There are different levels of severity of migraine attacks. Some of them are mild, some are moderate, and some of them are very severe. Now, the moderate and severe attacks need specific migraine medicines to be prescribed by a doctor, clinician. But the mild attacks can be managed by the patient on their own. So what should be the first line of treatment, which is safe also? And the bottom line is that in any medicine that you take as an emergency for the treatment of an attack, whether it's mild, moderate, or severe, please do not exceed the cutoff level of 10 per month.
Okay.
So you have to stay within the cutoff level.
So it's 10 crocins or
Yes, whatever
it
medicine
is.
you take that relieves you,
It should not be more than 10 a month.
not more than 10 per month. Otherwise, you can get into a zone of what is known as medication overuse headache.
Oh, okay. And it has ramifications
It has
on the kidney
ramifications. It
also.
could worsen your migraine headache, which you're trying to treat. So therefore, remember that overuse of acute medicines to abort your migraine attacks is harmful in the long run. So for mild attacks, what's the first line of treatment I would suggest, which is also reasonably safe, is a tablet of paracetamol. Now, paracetamol and a lot of migraine patients tend to have nausea, disturbance in the stomach, and tend to vomit also. So if you can combine a paracetamol with an anti-emetic or anti-vomiting tablet like domperidone and combine the two, then you find that you can abort most of the mild attacks. Some people benefit even with just application of pain balms, with a hot water bag, some people with cold packs. So that is also a doable for mild recurrent migraine headaches. Now, when you exceed the mild level and you find that that doesn't control your headache, then the next level are what are known as the NSAIDs, or what is in the ibuprofen category. Naproxen is one of the best in this category. So what borders between mild and moderate.
Okay.
Now the next higher level, which goes on to treat the moderate and severe one, I would recommend that you consult a physician who can recommend the migraine. There are designer drugs which are helpful only, which work only in migraine, and they do not work in other painful conditions like joint pains, back pains, and other things. These are called specific migraine medicines, and these are to be prescribed by a doctor. And to broadly mention the name of the category in which they are what are called as the triptans. These have been available for the last 20 years, and newer triptans are working better and better, and you find most of the patients can get relief using a triptan. And then there are some medicines which are available abroad but still to come in India, and these are called the GPANs. So this would be the range of drugs available. Then you have some nasal sprays also, some injection medicines also, but not all of them are available to us in India. So mild migraine you can self-treat. Take care not to exceed the limits. Moderate to severe migraine, get treated by a physician.
Okay. When do you see a physician?
When do you see a physician? When migraine occurs on a recurrent basis that hampers your quality of life, whether you're a student or whether you are ambitiously working at a young age in a corporate organization and would like to go up the ladder, or whether you are a housewife who gets recurrent attacks, you stay in a joint family, you can't get sick every now and then, it will be looked upon as you being a weak individual, because not many people understand that migraine is a real disease. Migraine is a biological, complex brain neurological disorder and not just anything psychological. So therefore, when your level of functioning goes down, and sometimes the attacks are so debilitating that you just cannot function, and you have to lie down in a dark room with the lights out, with the sound not being there, and the rest of the family has to go on with their routine work. Such are the times when you need to, when your quality of life is getting affected, then you need to consult a doctor, because just acute treatment alone, I always tell my patients, do not treat just migraine the attack, treat migraine the disorder, so that in the long run, long term, your frequency, your severity, and your quality of life should improve. It is not just treating today's attack. So you'll have to look at treating the disorder.
Okay. All right, doctor, we have a lot more questions with regards to migraines. We need to take a short break, but we'll be back with more. Stay tuned.